Hey guys, my name's Bella. I'm one of the nurses here at Pediatric Associates. We've been getting a lot of questions from parents just about the current measles situation, and so we wanted to sit down with Dr. Mirup just to chat through some of the questions that y'all have been asking. So, Dr. Mirup, go ahead and introduce yourself.
Oh yeah, so I'm Dr. Mirup. I've been Pediatric Associates for a long time, over 30 years, just about 30 years. And I guess I have the unique experience in that early in my residency, in the very late 80s, early 90s in Northern California, there was a measles epidemic there. So I actually got to see cases of measles, so I do kind of know what it looks like. I didn't know at the time. I had to ask, one of the older docs there what I was seeing, but so I did get to see some measles, real life cases, and then kind of the aftermath and how we managed vaccines and things.
Thank you.
Yeah.
So basically, we're getting a lot of messages from families that are worried about what's going on. Can you offer just some reassurance about the current situation?
Yeah, so obviously, no, I mean, measles is a terrible disease, and it can cause, I'm sure everyone has heard all the possible complications, pneumonia, eye problems, and some very, very severe brain issues as well. But on then having just been through COVID, everyone is kind of thinking, oh no, are we in another kind of COVID situation? Well, the big difference is, first of all, we know about measles. We know a lot about it, and we have vaccines very well, well researched, and we've been giving those for many years now. Also, what's really different about COVID is that most of our population is immune to measles. So, so what we need to do is protect the ones who are not immune, and that's obviously in pediatrics. That's going to be our younger patients, and then obviously there's other more rare kind of situations with immunocompromised individuals. So anyway, we'll cover that in a little bit.
Okay, so you did kind of start touching on this, but can we talk about when the measles vaccine is indicated, what age groups, and then when it's not yet needed and why?
Yeah, so like I said, we've been giving measles vaccines routinely. The first dose we like to give after 12 months of age. The second dose, in our practice, we've routinely been giving it at 3 years of age. Now, many other practices give it at 4 years of age. And so some of it was, we decided a long time ago, is kind of based on my experience in California, is, why not get at least an extra year of protection after, two MMR vaccines, and giving it at 3 as opposed to 4. I did phone a friend that I went to med school with, who's an infectious disease expert on these things. I asked him, is it okay to give an MMR early, and routinely at 3 as opposed to 4? And he said, yeah, there's no reason. The only main reason they recommended it 4 to 6 years of age was to make sure they got it before they started school. So obviously we just then decided to give it at 3 years of age. But theoretically, you can actually get it, the second shot a few months after the first one. Now, the only logistical reason, there's other vaccines we routinely give, and then you do have to space things a certain way, so logistically we thought it's best to give it at 3, give the second one at 3. So the reason we don't do it earlier than that is because the mom's, maternal antibody is really high in the baby, which is great. That means they're immune to measles, and that first 6 months especially. So after 6 months, the antibodies start to drop quite a bit from the mom's antibodies into the baby, so we become a little more susceptible to measles at that point. So that's why we don't really, we wait till 12 months to give it, because that's when all the mom's antibodies are completely gone. Now I know we've been asked a little bit that 6 months to 12 months, interval. And so a lot of our families travel internationally. They're going to places where measles is a lot more common, endemic. So we do go ahead and give it to those families. Now, if measles does become a lot more prevalent in the area in Central Texas, then we might have to routinely start giving it at 6 months. And this is something we did back in the, again, back when I first started practicing here and in California. It was a routine kind of thing to give it right at 6 months, the first dose. Now, the problem with giving it, the main downside from that 6 to 12 months is the maternal antibody, the mom's antibody, makes it so the vaccine does not work as well. It does not give that long-term immunity, that awesome 93% immunity from one and 97% from two. So it doesn't give you that. So that way, that one we sort of don't count for the lifetime MMR vaccines because it doesn't work as well long term. So.
Last question that we've been getting a lot, because you can get the MMR vaccine early. I think one big thing that we're kind of talking about as nurses and as staff is, why is it so important for us to be judicious with who is getting those vaccines that we currently have?
Yeah, no. So if we had endless supply of vaccine, we would not be worried. But as predicted, and I'm sure no one is surprised, it's hard for them to keep up with the sudden demand, and not just in Texas, but there's been other places where there's some increased measles. So there's a sudden big interest, and so they're having to increase production. So there's going to be a little bit of lag time before we have quite enough. So our first goal is to make sure we get those babies who have no immunity, or very, very little immunity. So that's those 12-month-olds, because the maternal antibodies are gone by then, and especially if they're out and about or so. So that's going to be our top priority, is to get those babies all vaccinated. So we want to make sure we have enough vaccine for those children. Once we get more, we're going to actually be setting up some clinics, right, after hours, or I don't know if it's during hours or after hours, because we know the demand suddenly got really high. So we're going to be doing extra clinics to give the second MMRs or first MMRs as well. And especially if it starts being indicated for the 6 to 12 month of age, then we're planning ahead and trying to stay on top of that.
Okay, I think that's all the questions that we wanted to ask you today.
Awesome.
If y'all have follow-up questions, our nurses are available via portal, call. Just give us some time to get back to y'all with the increase in volume.
Yes, and and like I said, we're not trying to hold back vaccine from anyone. I know there's a lot of nerves and all that about it, but sometimes special situations arise where you're going to travel to West Texas, you're going to travel to some other place. Then then obviously we'll take all that into consideration as well. So if there's questions like that, please let us know. Thank you so much.